Hey guys, welcome back to the Pulling Curls podcast. Today we are talking about our pelvis. And right where your pelvis comes together is a little area called the symphysis pubis. And sometimes those two sides don't want to play nice during pregnancy. So let's untangle it. Hi, I'm Hillary Erickson, the curly head behind the Pulling Curls podcast, where we untangle pregnancy, parenting, home, and even travel. We know there's no right answer for every family, but hopefully we can spark some ideas that will work for yours. Life's tangled, just like my hair. Okay, guys, before we get started, maybe your pelvis doesn't always want to play nice, but you know, one way to play nice is to leave me a review. Like, I totally appreciate it. And maybe it would cure you. Okay, it probably won't cure you, but leave me a review. Thanks. This is my guest's second time on the podcast. She is the director for pelvic rehab at the Doctorate of Physical Therapy. She's a physical therapist. She has tons of information about our pelvic floor, and she has so much good information on the TikTok, which is where I met her. I want to introduce today's guest, Ashlie Crewe. Do you feel prepared for your delivery? In just 3 short hours, you can be prepared for the confident, collaborative delivery you want. You'll know what to expect and how to talk with your healthcare team, and there are no boring lessons in this class. I'll use humor, stories from my 20 years in the delivery room to engage both of you. I love how Alyssa told me that she found herself laughing at things that used to sound scary. Most of all, you guys are going to be on the same page from bump to bassinet. Join the online prenatal class for couples today. You can save 15% with coupon code UNTANGLED. You can find the link in the show notes. Hey, Ashlie, welcome to the Pulling Curls. Welcome back to the Pulling Curls podcast.
Thank you so much. It's good to be back.
I love to talk about the pelvis.
Me too.
I have a crocheted pelvis just in the room behind me. It's fine.
Yeah, right? It's super chill. I have a little mini office in my downstairs, and there's a pelvic model. And then on the wall in front of me, there's a kind of a uterus and a penis and another pelvis. And, you know, everything's fine. Super casual.
It's just anatomy. It's fine.
That's exactly right.
Okay, so today we're talking about your pelvis and how sometimes it likes to get divorced while you're pregnant.
Get divorced. That's the best way. Maybe just a little separated. It's trial separation.
Yeah, it's having a trial separation. Some women's like full-on divorces though, right?
Yes. Some women's full-on divorces.
But that's pretty rare, right?
Yes. God bless. Yes, that's rare. Thankfully, yes.
Okay, so what are the symptoms? Because I had it with my last one, and obviously I talk to doctors all the time, and they were just like, it's fine. You're fine. What are the symptoms?
So we're talking about the joint at the very, very front of your pelvis. So if you've got vulva, it is kind of right where your mons pubis is, where the kind of pubic hair starts. So pain usually starts there. It tends to be pretty sharp pain, but then it can radiate kind of into your abdomen a little bit, sometimes down your thighs. And this usually causes a lot of problems with things that you do with one leg and not the other. So I always kind of say, think about if you stand to put on pants, and as you lift one leg up, that usually causes pain. Going up and down steps tends to be really painful, pain with turning over in bed. And sometimes people can get clicking or almost clunking sounds kind of coming from that area of their body as well. And then so a lot of people, I think, you know, the most common thing that I think of is if we see a pregnant person doing the quote unquote duck waddle, that's usually in an attempt to not let their pelvis move a whole heck of a lot. And so if I see someone walking into the clinic who is pregnant or postpartum and they're quite a pretty significant kind of waddle, that gives me a clue that their pubic symphysis might be a little problematic. So, but pain in that area and maybe some clicking is probably the biggest symptoms.
Okay. So mine felt like electric.
Yes.
Exactly. A lot of people say, and I always like make a lightning bolt right over the person's crotch when I make an image for this.
That's perfection. Yes.
But that's what I always felt. And I still feel it now, like a couple days after my period, when your body has that hormone in it also, I'll be like, oh, I'm so glad I'm never having another baby. That's also what I think.
Yes.
I'll feel it now and I'll be like, oh, I didn't need that.
Yes. Every once in a while I tell people about, like, I remember standing in my closet trying to get dressed for work and like throwing my pants on the floor and trying to figure out how I could like wiggle a foot into it and not experience that pain. And I remember just crying because I was like, I can't do this. It's going to give me that zap. Oh, Lordy. Yes.
Yeah. But I do think the pants thing is like the number one when I ask women, well, does it really hurt when you put on pants? Because a lot of times people just have an ache down there because the baby's like sitting on all of those tissues and stuff like that. But the pants thing, I think, is a great indicator. So they didn't ever think I had it because, I mean, I didn't really bring up the zapping feeling because I didn't really know how to say it, but my tailbone hurt so bad and forever. And they never mentioned that it could be my pubis symphysis. But the more I researched, I'm like, oh, it was just because things are off in the front part, it adjusts in the back, and that's what caused it.
Right. I mean, we have this ring of bone that the baby sits in, that is the pelvis, and there's only so many spots on that ring of bone that are mobile. So there's the one in the front, and then there's two spots on either side in the low back. And so, there's only so many places that stress can go. And so a lot of times we'll refer to it kind of all as pelvic girdle pain, which can be kind of anywhere in that ring. But in the front, it's typically referred to as pubic symphysis or symphysis pubis dysfunction.
Yeah. I think pelvic girdle pain is confusing because a lot of times people have that ligament pain,
yes,
which is near the pelvic girdle, but not associated with your pelvis. It's your uterus tying to your, anyway. There's just so much fun pain.
There really is.
And really, there isn't a whole lot you can do for ligament pain, but there is stuff you can do for symphysis pubis pain. I mean, to a point.
Yes.
Having the baby being the best prognosis of fixing it.
Maybe not the most efficient if you're only 18 weeks in, but yeah. And I would say, I mean, we can do, in pelvic PT, we can do some things to help around ligament pain a little bit, but definitely for this pubic symphysis pain, that's where we can really make an impact.
Okay. So if people are listening, either if they're pregnant or postpartum, because it can last quite a while into your postpartum period, what should they do?
So, I mean, you need to get to a pelvic PT or OT or pelvic rehabilitation professional first and foremost, because the cool thing about it is, we've got this ring of bone with a few areas of movement, and it's designed to be very stable. The way the bony anatomy works, it's designed to be really stable. But the problem is, when we go through a pregnancy, that's when the most change in those joints happen. So the other part of this is that the pelvic floor muscles, quite honestly, line the inside of that ring of bone. And part of the pelvic floor muscles' job is to contract and stabilize and compress those joints. I mean, my question for God when I get there is, we go through all these changes with our bony pelvis. At the same time, our pelvic floor is being changed because of a pregnancy, and then either a vaginal delivery or a surgical delivery. Either way, these pelvic floor muscles just really go through another huge change, and it's their job to help stabilize that ring. Like, could we have done this a little bit better? Is my question for God when I get there. And so, but the idea behind a little bit of pelvic PT is that we're going to help get these muscles working a little bit better so that they can do their job and stabilize that pelvic ring again. Because if somebody had a vaginal delivery, we know those muscles were stretched, sometimes some of them up to 250% of their length. So I tell people, think about your hamstrings. If I stretched your hamstring 250% of its length, your hamstring does not work after that. Same thing with the nerves that are inside those muscles that control those muscles. They undergo a significant stretch injury. So then no wonder where they're not firing well to contract and stabilize that pelvis. And so that's the pelvic PT's job, is to help patients figure out how to get these muscles kind of active and working again to help kind of give those joints the stability that they need so that you can, put on pants without crying in your closet like me.
Or a skirt. Like, there really were very few options. I guess you could do a dress if it went over your hair.
Yeah, exactly. Right. Exactly. I'm like, but I'm a curly hair girl too. I don't want to put a whole lot over my head.
It's a lot of frizz.
It sure is.
Plus dresses when you're like 9 months pregnant. I'm always like, oh, look at everything's a high-low.
Right. Exactly. And then I was working in a PT clinic. I can't demonstrate exercises in a dress. Something has to go on. So, oh yes.
That's for sure. Okay. So people should probably talk with their doctor. Most of the time we need a doctor's referral to get physical therapy with our insurance. I mean, insurance.
Insurance. Yeah. It depends on the state and depends on the insurance. If you have an insurance that is provided by the federal government, so Medicare, Medicaid, yes, you need a referral. But most states have direct access to physical therapy, meaning that you can come and see me without a referral unless you have an insurance that's provided by the federal government. So if somebody has a Blue Cross or an Aetna or, all these other commercial insurances, most states do allow patients to come and see us for, in Pennsylvania, which is where I am, it's up to 30 days and I'm allowed to see a patient without a referral. But I always say sometimes if somebody is pregnant, the therapists feel a bit more comfortable if we know an OBGYN or a midwife or somebody has seen that person to say, hey, this is not a high risk pregnancy, nothing you need to know about, that kind of thing.
Oh yeah, obviously.
Not a bad idea. Yeah.
Definitely definitely talk with your doctor. Plus, they might have somebody that they know who does this.
It's really good.
I went to physical therapy with my third when it was the worst, and she didn't even mention it. I had like pain in my side plus that, and she just like diagnosed scoliosis.
Yeah, which is ridiculous during your pregnancy. So definitely talk to your doctor, and then check out, even Googling like pelvic PT, because physical therapy is different than pelvic physical therapy. And so not every physical therapist is going to be brilliant at pubic symphysis dysfunction. So it'd be great to find a brilliant one in your area.
When you call the office, are you saying, do you specialize in pelvic, or do you have a physical therapist who specializes in pelvic floor rehab? Is that what you're talking about?
Yes, that's perfect. Yes.
Okay. Because sometimes I'm like, I need somebody that can help my electric pain by my pee-pee hole. And
I mean, truly, like that might scare off an orthopedic physical therapist who thinks they can help with your pelvis. But if you say zappy pain near my pee-pee hole, they're like, no, that's not me.
I'm like, it's not a bladder infection. It's something else.
Right.
Okay. So if people, let's pretend like physical therapy isn't in people's, like they don't have insurance or they can't get to it. Is there anything people can be doing at home that can help with this type of thing? Or if their doctor's like, that's just normal, suck it up.
Oh, okay. You're going to hear my significant bias. You're going to make me rage here today, Hillary. I would say if your doctor says it's normal, suck it up. Find a new doctor is my short answer, because I think that's been so common that's been what pregnant people have been told for so long, that this is, what do you expect? You just had a baby, or you're pregnant and it'll go away. And truly, even in my childbirth education classes through a major medical institution where I am, they had a physical therapist and like came and presented. And I was like, okay, like he's going to, tell me all these cool things. And then he was like, yeah, like we really can't help you until after you have the baby. And I was like, I don't think so, buddy. Anyway, and now I've lost track. What was the big question? I completely forgot.
So if physical therapy is like not in the picture, is there stuff people can do without a physical therapist?
Yes, there are a cajillion resources online to figure out, to make sure that you're doing pelvic floor contractions correctly. I'm sure you're going to link my TikTok or something.
Yes.
I know I have a video on there about that, because that's going to be one of the most important things, is getting those muscles kind of working again.
So this being after the baby?
Yes.
Is there anything people can do before?
I was going to say during pregnancy as well. Absolutely. They want to start doing pelvic floor contractions. And I like to really combine those pelvic floor contractions with the movement that might be provoking the pain.
Putting pants on.
Yes, exactly. And so, because again, those pelvic floor muscles are supposed to sort of reflexively contract and stabilize our pelvis while we do those things. The problem is when we're pregnant, there's lots of extra stress being placed on those muscles, and it's harder to do. So ideally, before people get pregnant, we would be doing some lovely, like general fitness for people who eventually want to have a baby. They would include lots of pelvic floor exercises. And I mean way more than just your basic Kegel, sitting at a stoplight or laying in your bed, squeezing. But it's important to start thinking about, can I contract my pelvic floor muscles just a little bit, maybe while I pick up a laundry basket? Can I contract those muscles when I go from sitting to standing? And if we can incorporate that kind of stuff into even before pregnancy happens and kind of build as much strength as we can, it's very likely we're going to have less symptoms of pubic symphysis dysfunction. I don't have any research articles to support that. It'd be great if we did some like prenatal, like prenatal fitness program to see what would happen, but we're in America and that's not going to happen anytime soon. But then throughout the pregnancy, to continue to try to strengthen those muscles and recruit those muscles while you're doing the thing that is painful, provocative, things like that. The other big thing I tell people is, again, it's mostly asymmetrical movements that really cause most of the problem, because there is a level of torque that's going across those pelvic joints when you're doing something asymmetrical. So sometimes we just need to modify tasks a little bit. So instead of, lunging to reach down or doing what we call the golfer's lift, when you think about standing on one straight leg and like lifting the other leg up and reaching down, I tell people, just give me a squat, because that's nice and you're doing symmetrical things with both legs. And sometimes that's less painful. So there is things like that. That's just a matter of activity modification. And I am sure, I've not looked, but I'm sure there's a cajillion things on YouTube about, what to do. So YouTube, TikTok are great resources for some of that stuff as well. Then there are belts as well. these SI joint belts or pelvic belts or whatever you want to call them. That's not your typical like maternity belt support that's meant to support the abdomen. These are, I don't know, maybe I'm showing you, like all the listeners can see my fingers, maybe 3 inches, and they're really thick, made of thick material. And the idea is they kind of sit right around your pelvis, so just underbelly. And the idea is they kind of compress those pelvic joints for you. Now, I'm a little biased about all of this because I think what the research shows is that those belts would have to press in with about 7 newtons of force to actually compress the joints anymore. And so no piece of elastic is going to compress with 7 newtons of force. So, I mean, I don't think it's actually compressing the joints itself. In the PT world, we tend to think about, is it just helping give some input to your nervous system, input to the muscles to make things work a little bit better? Maybe. And I'm okay with that. For me, I kind of jokingly talk to my patients. I'll let them, say, hey, it's worth a try. But for me, again, I worked until the day I delivered with both my children. And to get these belts tight enough to do anything, you got a whole heck of a lot of muffin top situation happening, especially when pregnant. And I was not comfortable in my professional environment looking like that. And so I was like, nope, I will just deal and contract my pelvic floor and try to, rehabilitate as best I can.
Yeah.
So, but it is an option for folks if it is really significant. I've got people who were essentially bedridden because of pubic symphysis dysfunction. And for them, I'm like, listen, if you're going to be in your bed hanging out, you might as well put that belt on if it's going to make, rolling over in bed feel a little bit better. And if you're in like this lovely, like moo-moo situation and, no one's going to see you, you're not going to worry about that, then that's a great option as well.
Yeah. So I started to notice that tight pants I felt better in, but when I would wear scrubs at work, because we all get a size up in our scrubs because we're all over the place, it was miserable at work because zero support from the scrubs. So I just got a bigger top and I stuck my little hip thing on and wore it at work. And that was like the only way I could survive. But when I was at home, as long as I had on tight pants, lucky family, it was fine. So yeah.
Absolutely.
Do you think you can become too reliant on those belts? Because a lot of times they're like, oh, are your muscles, building if you're wearing the belt all the time? But honestly, it's not comfortable enough that you're like, let me wear this 24 hours a day. It's the joy.
Right. No. And I tend to say, if someone's going to wear those belts, I really encourage, because the short answer is we don't know. I'm a huge proponent of evidence-based medicine, and we don't have any research to say, does that actually over time weaken your muscles? It stands to reason that it might. But again, I kind of take the approach of these belts aren't actually truly compressing the joints. They're doing something to make those muscles fire a little bit better and to give your nervous system some input. And so in that situation, it probably helps long-term more than anything. I do often tell patients though, because we don't know, I don't necessarily think it's a great idea to just wear it all day, every day, throughout 24 hours a day. But if you're going to go and work your 12-hour shift as a nurse, go ahead and put that on. Or if you're going to go walk around an amusement park all day long and you're going to be dying by the end of the day, go ahead and put it on for that. And then maybe if you're going to be hanging out at your house, talking to, doing podcast interviews all day, maybe leave it alone.
Yeah.
So I kind of tell my patients, I want you to use it when you need it, but not to just live your daily life.
Okay. So if people are looking it up on Amazon, they're looking for a SI joint belt?
An SI belt.
Okay.
And
it's not like where you would wear a regular belt. If people are picturing this in their mind, it is over your hip. So it goes over the top of your bum, right?
Yes, absolutely.
Over where the electric pain is, basically.
Yes, exactly. I was going to say, it should be like, if you put it on without any clothing on, it should be going right over pubic hair.
Yeah.
Or where pubic hair would be if you've removed it. But yeah, so it's really, really low.
Okay. So how long does it usually last?
Right. So typically I see if someone's going to have it at the early stages of pregnancy, and I'm talking first, maybe second trimester. Again, we have zero research on any of this because of course, but if that's the case, I usually see it as things are changing, people seem to have a lot of symptoms of it. And then later on, it seems to go away. But I see a lot of people too, who then have it maybe right before delivery. And then if we have, any tearing of the perineal muscles during labor and delivery, when we think about the actual physical act of getting a baby out of our pelvis, there's a ton of stress to those joints, particularly if we're birthing in positions where we don't allow those joints to move very well. We kind of, you're going to hear me about my rant about birthing on your back, because when we do that, so if you birth laying flat on your back, you are really fixing the 2 joints in the back. You're not allowing them to move very much because the whole weight of the mother is pushing pushing back there. So all of the stress of that action has to go where the pubic symphysis is. And so that's when I really see it becoming a problem in the postpartum period. And truly, if it does not get rehabilitated, I don't know how long it would last. But typically it's an orthopedic injury. And so let's say somebody came to me 2 weeks postpartum with pubic symphysis pain. I would really expect that if they came to therapy and did exercises at home, that really by the 8-week postpartum mark, they should be feeling a whole heck of a lot better. They probably don't need to see them any longer than that on average. I'm not making anybody any promises that I can fix all pubic symphysis pain in 6 weeks, but I would say between 6 to 10 weeks with treatment, it should be tons better.
Oh man.
Tons better.
I was like 2 years. I think she was 2 years and like 4 months old before I could start to sit without being really in pain. And I did go to a physical therapist. So you really need to find a person that can like
somebody great.
Yeah. And again, I went to physical also saying my tailbone hurts because that is the thing that hurt the most. And so, use all of the symptoms. I did say the electric pain in the front, but they kept like, I got an epidural in my tailbone.
Oh.
And it wasn't that at all. It was always the rest of it. And I had really bad plantar fasciitis from it because once I resolved the SPD, the plantar fasciitis went away.
Yeah.
Because it is all tied in, people.
Absolutely right. I tell people, like, I started looking at the pelvis, but every time I see a patient, I kind of say, like, I need to look at you from head to toe. I'm going to look at your whole body, probably give you the most comprehensive exam you've ever gotten in your entire life because I need to look at every aspect of this.
Yeah. And mention all the problems that you have.
Yes,
because I don't know that I brought up, nurses just get plantar fasciitis like it's our thing.
Yeah.
But so did I mention that? I don't know.
Right.
But later I was like, oh, because my pelvis was tilted, it was stretching those muscles. I am stupid.
Exactly.
All that anatomy down the drain. Completely useless.
I understand. Well, and it's funny because I talk to patients all the time and say, you think of your vehicle, right? And let's say you hit something hard and you bend the frame of your car. Okay. Like you do affect your pelvic ring. You bend the frame of your car and you just keep driving on it. Like, are your tires going to know eventually? Yes. Like that's all it is. It's just simple mechanics. It's simple physics. We can do some things along the line, but yeah, we definitely need to address the whole system because it can have far-reaching implications. And so I always think too, we've got to talk to people about how are they sitting when they're breastfeeding or bottle feeding or pumping or whatever it is that they're doing, because especially in the early days of infant life, there's so much that mamas stereotypically are doing that are sitting and leaning forward. That is like the position. And so we need to talk about, let's talk about like looking up as far up as your neck as well and as far down as your feet. So absolutely, we gotta look at the whole body.
Yeah.
Oh yeah.
So most of all, don't let your doctor push you off. If you've got that electric pain, if putting on pants is hard, don't let him just be like, that's ligament pain. Ligament pain does not come when you pull one leg up. Ligament pain is like more to the side, and it's usually when you cough or you turn. But yeah. So if you have that, tell your doctor and expect them to send you to physical therapy because that's not what your OB specialized in. You aren't looking for your OB to fix this.
Right. No, it's unlikely.
Yeah.
I'm a firm believer in, we all have our magical gifts that we do. This is not something I would expect an OB to fix. Just like I mean, in a pinch, I could probably deliver a baby, but like an OB is definitely the better choice.
In a pinch, the floor can deliver the baby.
Right. Exactly. Exactly. If we're on an airplane and I'm the only one, I'm the most qualified, I'll do it. I think I can handle it. But if there's an OB, I will let them do that. So let the pelvic PTs help folks with pubic symphysis dysfunction.
Yeah. You'll be like, don't let her deliver on the back. And they'll be like, how else are we going to deliver in
We're on an airplane. We're on an airplane. Absolutely.
All right. Thanks for coming on, Ashlie. This was awesome. Get help if you have it. Don't let your doctor or whoever say this is normal because I probably talked about 15 when I was pregnant with my last, and they were all just like, it's normal and it's going to take forever to fix.
Yeah, great messaging, docs. No, we'd like to rewrite that narrative. Common, not normal, is possible to fix.
Yes.
Officially.
Yeah. All right. Thanks, Ashlie.
Thank you.
Okay, guys, it's so common. And the sad part is that it's just as common for those doctors to just be like, it's just ligament pain and just leave the room. I don't know. If you are picking up one leg and it is extremely painful, a physical therapist can help you. Ask for a referral. If they will not give you a referral, just go and pay the money. It would 100% have been worth it for me to just go and pay the money rather than waiting for 2 years of pure pain every time I sat for an extended period of time. So, this comes in all different shapes and sizes and forms. And I think the pants thing is the best option though. So I hope you guys enjoyed this week's episode, and I hope we realize how important our pelvises are. Big fan of my pelvis. It does a great job normally. Thanks so much for joining us on today's episode. We know you have lots of options for your ears, and we are glad that you chose us. We drop episodes weekly, and until next time, we hope you have a tangle-free day.